Hi, my name is Malvin Finkelstein. I've been an acupuncturist and Oriental medical doctor for over 30 years. From my clinical experience treating thousands of patients, I've developed Microcurrent, Positional, Tuina, or MPT. For healthcare practitioners, what you will glean from this presentation will change the way that you treat pain. For patients, you'll find a dramatically effective way to relieve your pain. First, I'm going to show you what MPT is and how it works, and then I'll show you a demonstration. So let's begin. MPT is a new method that relieves pain and restores range of motion to joints in the body. It doesn't use acupuncture needles, only microcurrent electricity and hands-on treatment, yet it achieves dramatic changes in range of motion and pain almost immediately. How does it do this? MPT combines treatment of specialized acupuncture and trigger point locations using a handheld microcurrent electrical device that relaxes tight muscle knots. Along with this, an acupressure Tuina technique is done that gently stretches these tight muscles. Tension melts away in seconds. The positional portion of MPT involves positioning the body in specific ways to stretch and maximize access to treatment areas. The final component is patient education. This involves correcting posture and suggesting ergonomic adjustments. Postural Qigong stretches that target postural compensation are recommended for patients to enhance the treatment effectiveness to be done at the patient's home. MPT offers quick, effective pain relief for neck pain, back pain, knee, shoulder, and joint pain, as well as for headaches, sinus, respiratory, digestive, and gynecological problems, and much more. Patients who have not been able to experience any pain relief from other treatments have finally found relief with MPT. Most people with neck pain also are unable to turn their head fully. This particularly becomes a problem when you're driving in your car and you're trying to turn your head behind you to see traffic. So let's see how far this patient is able to turn her head. Turn your head towards me. And you notice that we have a fair amount of restriction and a certain amount of tightness and tension in this area. We're going to begin the treatment by putting the patient in a treatment position where she's bending her head forward and turning her head to the side. This stretches some of these muscles and contracts others so that we get a clearer view and a clearer way of getting into those points. We'll now take a closer look. We begin treating this particular line of specialized locations of acupuncture and trigger points that goes through several different muscle groups: the anterior trapezius, the splenius capitis and cervicis, and the semispinalis capitis. We begin by using our microcurrent device on our first point while we're stretching the skin and the muscles the way they're supposed to be going. There's a lot of tension here. This muscle is not supposed to be tight, so we want to stretch it in that direction. We come in. The microcurrent device, the ETPS 1000 unit, loosens up the tightness in these muscles very, very quickly. And we just wait for that tension to loosen. And there goes the first piece of it. Once we get that moving, we then stretch the tissue just a little bit more, going to the next tight area. Stretching the tissue as much as it can, loosening it up with the microcurrent device, which loosens it up. And we then shift to the next place, moving along this line. We're in about the splenius capitis at this point, probably splenius cervicis. Moving to the next one. And the final one. And one more. We then go to a secondary series of points that are right next to the vertebrae in the deep paraspinal muscles, the rotatories and multifidi. We're stretching these muscles the other direction, so we're going a little lateral, getting our unit in there, loosening up right next to the spine on these very deep muscles. Sometimes takes a little longer to loosen that up, but that's loosening up pretty good. And we're shifting that quite a bit. And we're going to do that at another level. The first one was about C5, cervical 5, 6. This is C4, 5. And these are the points that are in acupuncture terms are called the Huatou Jiaji points, but we're treating them in a different manner. And that loosens those up pretty well. And we're going to now have her come back up and turn her head in this direction and see how far she's turning. And she turns quite a bit farther, and there's much less tightness and restriction in this region here. That completes the demonstration. Over the years, so many of my patients have benefited from MPT. I wanted to be able to help more people than I could treat in my own practice. This led to the development of MPT training programs both in seminars and online format. MPT is currently being used by many health professionals who use hands-on treatment and electrical treatment. This includes acupuncturists, massage therapists, physical therapists, nurses, chiropractors, medical doctors, and patients as well as their families. As you've just seen, MPT is a fast, effective treatment for treating pain and relieving range of motion. This presentation is just the tip of the iceberg. There's so many other facets that can't be covered in one presentation. For more information, watch my free introductory video, What is MPT? Or watch video clips, samples from the various classes. If you like what you see, sign up for seminars and online training. Thanks for watching. I hope to see you at one of the seminars or in the online training. I know this will be a valuable experience for you.